at Edward Hospital in Naperville. And my background is in clinical microbiology. But right now I am part of the COVID steering committee at Edward, and been doing a lot of work with that. I work closely with Dr. Pinsky.
Hi, thank you for having me. So I'm Jonathan Pinsky. I'm an infectious disease physician. I've been at Edward Hospital since 2001, and I'm the medical director of infection control at Edward. I deal with a lot of COVID. I see most of the patients in the hospital who get admitted with COVID. We treat the COVID patients. And I've also been a part of the vaccine effort and been a part of educating physicians and staff about the vaccine. And I'm happy to be invited here to help educate you folks.
All right, we have some PowerPoint slides just to start with to kind of get us all on the same page, and then at the end we'll take questions, because I'm guessing that's probably what you're most interested in, getting some answers to questions that you have. I'm looking for my PowerPoint. Sorry, bear with me. All right, I'm hoping that you can see PowerPoint. Yes, okay.
Mm-hmm.
Oops. It'd help if I was at the beginning. Sorry, I'm working on a borrowed laptop, so I'm not at my usual desk in my office, so I gotta figure this out. There's so much that we could talk about when it comes to COVID-19 and the pandemic in general. These are the topics that I thought we'd cover tonight. And then obviously, if you have other questions, feel free to ask all of that at the end. We'll try to get you any answers that you need. Let's talk a little bit about the pandemic itself. These are data from the Centers for Disease Control, which is on the left of your screen, and the Illinois Department of Public Health, which is on the right of the screen. In the US to date, there have been more than 27 million cases of COVID-19, and the pandemic has occurred in several waves. Started last spring, had another peak in the summer months, and then again, you can see sort of sequential peaks in November, December, and January. By contrast, the Illinois data, which is on the right of your screen, we had a small peak in the spring, not much going on locally in the summer, and then we hit our highest peak about mid-November. And that is very consistent with what we saw at Edward Hospital. Our data mirrors the Illinois data pretty closely. We know that COVID can present in many, many ways. Some people have very mild illness, and some people have very severe illness. The symptoms of COVID are quite diverse. Many people, in the beginning, we thought that this was very much a respiratory disease, and people would present with fever and cough, similar to influenza. But we know now that some people can present with GI illness, with nausea, vomiting, diarrhea. Some present primarily with fatigue, muscle aches, headache. We've also noticed that a loss of taste and smell seems to be quite the hallmark of COVID-19. We've also learned this year that not all people who get infected with COVID ever develop symptoms. And yet people who are asymptomatic or pre-symptomatic, because their symptoms haven't started yet, can spread the virus to others just as effectively as those with significant illness. We also have learned this year that there are a number of factors that put you at increased risk for severe illness. That is both hospitalization and death. Your risk for those things increase almost exponentially with age. So in the table on the right, the comparative group are very young people, ages 18 to 29. And as each decade progresses, the risk for hospitalization gets higher and higher, as does the risk for death. We also know that people with lots of chronic health conditions are more likely to have severe illness. I want to talk just a little bit about some terms and timelines, because I think that that's really helpful for us to understand this and share this common language. People who have COVID infection are considered contagious starting 2 days before their symptoms start, and in general, about 10 days after their symptoms start. For people who have severe illness or are immunosuppressed, that might be up to 20 days after illness starts. And so people who are infected with COVID-19 need to be in isolation. And isolation is that term that means staying home and away from others in that period when you're contagious. So isolation typically lasts until you're at least 10 days from the onset of symptoms, or if you're asymptomatic, then it's 10 days from the date of your positive test, and your symptoms have improved and you have been 24 hours fever-free without the use of fever-reducing medications. So isolation is for people who are infected with COVID. That's compared to people who are exposed to COVID. And by exposed to COVID, I mean you've had close contact with someone infected with COVID-19. And the CDC defines close contact as being within 6 feet of someone for 15 minutes or more. So some of the time period that we're really worried about with people who have had exposure to COVID is called the incubation period. That's the average time from the time you have that exposure until you're going to become symptomatic. And the incubation period ranges anywhere from 2 to 14 days. Since 14 days is the max incubation period, that corresponds with the period of quarantine. And quarantine then is defined as what we do with people who have been exposed to COVID-19 but have not yet tested positive. They're going to also remain home and remain away from others, but this time it's for 14 days because that's the incubation period. I want to talk a little bit about testing for COVID, and as I thought about this and prepared to come speak to your group, I thought probably the 3 questions people might have would be, what types of tests are there? Should I get tested, and how do I get tested? So the easy question probably is, what types of tests are there? Most testing for COVID done at hospital labs or most big commercial labs are PCR tests. PCR stands for polymerase chain reaction. That's a molecular test that detects the genetic material of the virus itself. So it's a test that would detect current infection. It's run in fairly sizable labs, and so the typical result time is anywhere from 1 to 3 days. But PCR tests are considered the most sensitive test. In other words, they can detect very small, minute quantities of the virus. It's very, very sensitive, able to detect low levels of virus. The other kind of test that is a newer type of test is an antigen test. And that also is a test that detects current infection. Result turnaround time is usually a little faster. This may be a same-day result. It might be a result the next day. It's not quite as sensitive, but for people who are early in their infection and have a higher number of viral particles present, it's a good test as well. There are also antibody tests for COVID-19. Those would be used to detect past infection, but it can't pinpoint when you were infected. So for people who are actively sick or wondering if they have COVID right now, they need either ideally a PCR test, but potentially an antigen test. So when might you want to get tested? If you have any of those COVID symptoms, you should get tested, and you should get tested right away, because you don't want to delay that diagnosis. The faster you know that answer, the faster you can be in isolation, the faster you can notify the people that you've been around because they've been exposed and they need to quarantine. And if you have been exposed to COVID-19, had that close contact with someone who tested positive, you could consider being tested. You definitely need to quarantine, but you could get tested. The trick is you don't want to get tested too early, because you might not be able to have a reliable test result. The recommendation is that you wait until 5 to 7 days after your last date of exposure before you get that test done. And how do you get tested? Well, if you have a primary care physician, I would start there. Have that call with your doctor. Most physicians these days can do virtual visits, and so there are options to talk to your doctor without actually having to go into the office. There are also urgent care centers, walk-in clinics that you can go to, especially if you're feeling sick and you need to actually be seen and checked out by someone. But if you want to just get tested, maybe because you've been exposed to COVID, I would check your local health department website for testing locations. There are state-run testing locations that are available without a physician's order. So that might be another option. And I'm going to turn it over to Dr. Pinsky to talk about COVID vaccines.
Okay, thank you. All right, well, so the first section is what vaccines are available. So there are now 2 vaccines that were released and approved by the FDA under emergency use authorization. The first one was Pfizer, and that's a 2-dose vaccine, and the second dose is given 21 days apart. That vaccine is approved for people 16 and over. The second vaccine that was approved was the Moderna vaccine. That's also a 2-dose vaccine, and that's given 28 days apart, and that is approved for 18 years and older. And I just want to add that the data on those vaccines is very good. So it showed a 95% efficacy, meaning that, one group you would have 100 infections and the other group only 5. The group that got vaccinated prevented 95% of the infection. So it's a very, very good vaccine. Additional vaccines are coming. There's a 1-dose vaccine made by Janssen, and that is expected to be looked at by the FDA at the end of the month. Okay, now questions about should you get vaccinated? Well, the recommendation is that everyone get vaccinated. This is kind of like our way out of COVID. We've been masking and social distancing for a long time, and yeah, the numbers are down, but really we need immunity to get to the end of the road here. So the idea is that the more people that get vaccinated, the less people are susceptible, and the less likely it is to then get transmitted. So, there's really no contraindications to getting vaccinated. You can talk to your physicians about this. The only caveat would be somebody who has a severe allergy, which I'll get into a little bit later. Okay, how do I get vaccinated? So this is very difficult. This can be very frustrating for people because the supply of vaccines is just really not enough for the demand at this time. So right now, anyone 65 and older is eligible to get a vaccine, but there's just not enough vaccine right now to give to everyone. So different health systems are trying to find ways to kind of make a line of vaccines. So, if you're part of Edward Elmhurst or DuPage's Medical Group or Advocate or any of the other health systems, they probably have a way where they figure out to send you a message or an invite to come and get vaccinated. There's also several pharmacies that are corporate, Mariano's, Jewel Osco, Meijer, Walgreens. These are all implementing vaccines. It's very hard to get an appointment. You can go to the public DuPage County Public Health website or the Will County Public Health website. There's information. The thing about the vaccines, though, the availability, right now it's still availability is not great, but this is expected to increase a lot. So probably in the next month, there's just going to be a lot more vaccine out there. And, it's anticipated that we'll get to a point when there's more vaccine out there than there is demand. So that'll be a good thing. Okay, next slide. So what are the phases? So phase 1A were healthcare workers and those from nursing homes. Okay, so that phase 1A is still active, but now we've moved on to phase 1B. So phase 1B are people over the age of 65 and other frontline essential workers like teachers, firemen, policemen, postal workers, etc. And then after that is phase 1C, and that gets to people with chronic medical conditions who are not over 65. And I believe the governor announced that they are opening that up, but many of the counties are not yet ready for it because there's so many people in 1B that haven't gotten the vaccine yet. And logistically, it's just very difficult to try to remake the line with such a wide category. So even though that it's available, the governor says it's available, most counties are not, it's not available yet in most counties. Okay, next slide. So the contrary indication to the vaccines for both the Moderna and Pfizer is if you have an allergy to any component in the vaccine. If you have any other type of allergy, that's not a contraindication. If you have an allergy to an injectable medication, like you had, but not to the vaccine, but there was some other injectable that you reacted to, then that's considered a precaution. You can still get the vaccine, but you would have to be observed under medical supervision for 30 minutes. And there are other certain conditions where you would want to delay the vaccine. One is if you've been recently exposed to COVID and you're in quarantine. They just don't want you going out to the clinic because if you potentially have COVID, you don't want to get the vaccine at that time. The second reason would be if you actually have COVID infection. However, if you've recovered from COVID infection and you're not in isolation anymore, then you can get the vaccine. You just don't want to get it while you're still active. The third caveat is someone who receives something called monoclonal antibodies for COVID-19. The reason for that is that therapy actually is an antibody treatment, and that can interfere with the immune response to the vaccine. So you want to wait 3 months for that. And also, if you've had any other vaccine, it's recommended that you delay other vaccines for at least 14 days before or after the COVID vaccine. So remember, it's a 2-vaccine series. So if you get the Moderna now and then in 4 weeks, that means you wouldn't want to be getting any other vaccine then for 6 weeks. Next slide. Okay, so a few common questions. Can a COVID vaccine make you sick? Well, you don't get the infection from it, so you don't get the virus. Next pop up. Okay, so if I already had COVID-19, do I still need to be vaccinated? Actually, there is some immunity after a COVID infection, but there is some questions about how long immunity lasts. And in the trials, the Pfizer and Moderna, there were some participants who had antibodies for COVID, indicating they had it before, but they still got the infection. So we're learning that you can still get reinfected. The other thing about that is the antibody levels from vaccine are like 10 times higher than you would get from normal infection. And there's some evidence that in the South African variant strains that natural infection does not protect you, but vaccine immunity will protect you. So you actually get a higher level of immunity. It's more long lasting. Can you receive the COVID vaccine if you've had chronic health conditions? Yes. In fact, in the studies, it was given to people with a wide variety of medical illnesses, and it showed it was effective for people over 65, for people with chronic medical conditions, etc. If you have allergies to like food allergies, etc., you can get the vaccine. That's not a contraindication. If you're on blood thinners, yes, you can get the vaccine. Sometimes if you get a flu shot, you may be more susceptible to get a hematoma. That's the same thing with this vaccine. It's no different than any others. Now, how about pregnancy or breastfeeding? So in the clinical trials, they did not include women who were breastfeeding or pregnant. That was because it was a new vaccine and they wanted to make sure it was safe. Once they did approve it and it was deemed safe, then it was allowed to be given to pregnant women. Now, the CDC recommends that if you're pregnant, you discuss this with your healthcare provider. I would also add, though, since this vaccine went live, there's been over 30,000 women who are pregnant who've gotten this vaccine. And to date, there's no safety issues. So there's no reason to delay vaccination if you're pregnant or breastfeeding. Okay, what vaccine reactions are common? But let's get back to this first thing. It said, can I get sick from the vaccine? Well, you can get a fever. That's pretty common. That actually happens in 15% of people, but usually with a second dose. The first dose, not a lot of people get fever. It's that second dose when you get more of a reaction. That's very common, but that's a normal immune response. And then a lot of people get chills and then some pain at the injection site. But that's different than having an infection. That lasts a day or two. So these are the common things: fever, headache, and some pain in the injection site, most people. Okay, next slide. Okay, Mary, it's all you.
All right. I want to talk a little bit about how to stay safe and how to keep the people that you love safe. Right now, before you can get a vaccine, and frankly, even after you get a vaccine. And you've heard so many times, wear a mask, watch your distance, wash your hands. I want to put a little caveat to each of those. We want you to wear a mask when you're out in public and around people who aren't in your immediate family, but it needs to be a mask that fits you well and has 2 or more layers, and it needs to cover both your nose and mouth because you breathe in and out of both of those. When it comes to watch your distance, we are talking about 6 feet of distance. And when we say wash your hands, we're asking for at least 20 seconds of friction when you're washing with soap and water, or 20 seconds of friction when you're using an alcohol-based hand sanitizer. And if you're choosing an alcohol-based hand sanitizer, that should be at least 60% alcohol. A couple of other things to think about now, when we so desperately want to keep ourselves and others safe until that time that we can get our vaccine, avoid crowded spaces, especially indoors and especially in settings that might have poor ventilation. Don't touch your face. If you are out and about and your hands are contaminated from touching things, don't put your hands to your face to touch your eyes, to adjust your mask, to do any of that, unless you clean your hands first. And finally, I would urge you to have a plan. If you are in a shared household with others and one of them suddenly develops symptoms, do you know what you're going to do? The person who might be infected needs to get tested. Do you know how you can get someone tested? The person who might be infected needs to isolate themselves from others, and the people who have had close exposure need to quarantine. Are you prepared to do that? What would that look like in your household? And how would you get the necessary supplies that you need from outside? How would you take care of the person who's sick while you're still maintaining that degree of separation? It's a lot to think about, but I would urge you to think about it now before you need the information. All right, and my screen is frozen. There. I think we have time for questions, and I know we added quite a bit of time for questions, but frankly, people have so many questions when it comes to COVID. We just want to be sure that we're conscious of that and give you plenty of time.
Great presentation. Thank you. Good, solid information. So appreciate it. I'm going to now allow those who are with us to, if you have questions, to unmute and to ask your question. If you can be brief, I will definitely be controlling the mute button. So if you get muted, you know what happened. But go ahead and unmute yourself, ask your questions. I may have to direct traffic by calling names, but we'll let you go at it. All right. So let's not delay. Let's use our time wisely. Who's going first?
I have a quick question.
All right, we're going to go for Nita, Joelle, Marjorie, in that order.
Hi, I was wondering if you could speak to college kids coming home, what that should look like, what they should do first, how we should prepare for that.
Yeah, so college, that is a risk. So, I know a lot of colleges have recommended that kids not go back and forth between the school and home, because not only can they bring stuff back to the home, but when they travel, they maybe hang out with friends and maybe catch something and bring it back to the university. So it's probably just, stay put if you can. Your child should probably stay, at school, for the duration of the semester, and then, kind of come back and then stay home. Some schools are doing testing, to see if there is any cases, and some places are doing kind of surveillance testing, like U of I is testing all students. Other students are just doing kind of random testing. But I would say the safest thing to do is when your child comes home, maybe just have a kind of a 2-week quarantine. It doesn't have to be a full, all out quarantine, but maybe wear a mask, for a couple weeks, and just avoid close contact, for a couple weeks, until you kind of know that, he's not going to develop any symptoms, and that, and then, when they come home, the danger is then they could hang out with friends and things, and not wear masks and things like that. So, I think that just the basics, wearing masks, 6 feet of distance, when they're home with you, and especially, when they're with others, that would be the area. And then, as soon as you can get a vaccine, get a vaccine. In April, they're anticipating that, well, I don't want to promise anything, but, the anticipation is in the spring, then potentially they'll be in phase 2, and more vaccines will be available. So, if you can get vaccinated as soon as possible, and you can get vaccinated as soon as possible, that just makes everything kind of safer.
Great. Joelle?
Okay, thank you. So my question is about the second vaccine. So we understand that second dose is stronger, but can you speak to more of why that is? Why do some recipients of the second dose have such a stronger reaction to it?
So the second dose is a booster dose. So they're both the same vaccine. So what happens with the first dose is you're introduced to basically the spike protein, which is the kind of the nub of the virus. It's not a live virus. It's the RNA that makes the spike protein. So that spike protein elicits an immune response. And then what you get is white blood cells called B lymphocytes that populate your lymph nodes. And then they have a memory of that protein. So then when you get the booster dose, that protein gets introduced, and then those memory B cells get revved up and then produce a response. And so that second response is a lot stronger than the first response. And so that's why you see 15% of people get a fever with the second dose, where the first dose, it's only 1%.
Yeah, I think it's important to realize that all of those reactions to the vaccine are your own body's immune response in action. Like, that's what it feels like when your body's immune system kicks into action. And so the first time with the first dose, you get a reaction, but the second time around, your immune system already has seen this before. And so it's primed and ready to go and gives you a bigger reaction the second time.
Dr. Pinsky, you're muted if you can unmute yourself. Sorry.
Oh, I was going to say, at our hospital, we've been sharing stories about getting the vaccine, because almost, most of our healthcare workers got the vaccine. And a lot of people say, oh yeah, I got a fever, and then, but then the next day I was fine. And they're like, I feel absolutely great. This was totally worth it. Now I have immunity. I know that my risk of getting COVID now is very low. And I just had fever for a day. So it was like, no big deal. And it's actually, it's a very kind of an uplifting thing to hear.
Wonderful. All right. Marjorie?
My question is, does the vaccine have the same effect for the new variant of virus that we are hearing about this in the United States?
Yeah, that's a great question. So there are 3 new variants. The one in the UK, the B.1.1.7, it doesn't look like that has any diminution in the antibody response. The vaccine should work just as well for that. Now, the variant that we're a little more worrisome is the South African variant, the B.1.3.5. So that one looks like the vaccine response may be less. However, remember this, the natural response to infection is less than the vaccine response. So when they looked at blood from people who recovered from a natural infection and they tested it against the South African variant, it actually didn't neutralize the virus. But then they looked at blood from people who had the vaccine, and that actually did neutralize the virus. The reason for that is because the antibody levels that you get from vaccination are 10 times higher than you get from natural infection. So they were able to neutralize the virus. Now, it wasn't neutralized as well. I think it was about 5 times lower, but it was enough to control the virus. And so, the vaccines, the Moderna and the Pfizer, haven't been, like in the trials, there was no people with South African variants, so we don't know like the efficacy clinically. But the newer vaccine, this Janssen vaccine that's coming up, that was tested in South Africa. And people who had that vaccine, none of them got hospitalized with COVID-19. There were some people who got infected. And in fact, the vaccine was less effective against that than the US strain, than the wild strain. But it protected people against getting severe disease and getting hospitalized. So that's really important. So, it could be you get sick with it, but maybe just a little bit sick and you're not in the hospital. So, that's not too bad.
I was curious about long-term research or studies on people who have contacted COVID or have had the vaccine. Do you know, I know that for dementia and Alzheimer's, one of the signs is also losing taste and smell. So I was wondering if there was going to be any research on seeing if there would be a high correlation between people who contracted COVID-19 and, let's see, an increased probability of, let's say, something like dementia and Alzheimer's. And also, is there going to be long-term research on the vaccine or COVID over a period of 2 or 3 years to see if anything pops up? Because right now this time is not on our side. Like, we don't know if there would be an impact 18 months away or 2 years away or 3 years away. So is there any procedures in place to track so that one can study that?
Yeah, absolutely. So a couple things on safety. So when this vaccine rolled out, the FDA wanted 2 months of safety data. The reason for that is vaccine reactions that happen to vaccines typically happen within 6 weeks. So there aren't any vaccines around where you get like a reaction that would occur way down the road, like, months later. Everything pretty much happens in 6 weeks. That's why they gave the 2-month timeline. However, there is a vaccine, it's called VAERS. So after the clinical trials went, any other reactions to the vaccine are reported through the VAERS system. So right now we've had, I think, 50 million people who've received the COVID or the mRNA vaccines. I'm sorry, 50 million doses, not 50 million people. I think it's a little bit less than that. But the point being is there hasn't been any major safety issues, even with the 50 million doses, except for the allergies. That's the one thing. But even that is rare. And that's estimated in the Moderna that it's about 2.5 per million people that will have what they call anaphylaxis, which is a severe allergic reaction. So that's what we know. And now you have to think about this because, we have a pandemic on our hands. So, if they waited to release this vaccine, in 3 years, that doesn't kind of help things because we need to get this thing under control. But from what I know, listening to the experts on this, reactions to vaccines happen within a time frame of 6 weeks generally, and that's why they use that 2-month time frame.
Quick question. So I have someone that tested positive with COVID-19 about a month ago. They have multiple members in the family. They have subsequently quarantined for 14 days. They tested negative, but now the family member has just tested positive. Should they re-quarantine? Are they safe to stay out of quarantine, or should they re-quarantine the person that tested positive the first time?
So this is they all live together in the same home?
Within the same home.
And then one person tested positive after the quarantine was over, basically,
Yes.
is what the question is. Yeah. Technically, yeah. I mean, if they got re-exposed, because maybe they didn't get it the first time, but doesn't mean that you can't get it a second time. So, I've seen that actually with very large homes, multifamily homes, where there's just kind of goes from one person to the next person. And so it could be more than 2 weeks in that chain.
Okay.
You could have kind of successive infections. So, yeah, probably contact your physician and maybe the thing to do would be to get tested again.
Okay.
But yeah, technically you would need to quarantine. Yep.
Okay, thanks.
Janice Thomas has a question.
Yes, Dr. Pinsky. My question is this. With this vaccine, do we know as of now, will this be something that's done annually, or will this vaccine be a one-time situation for most individuals?
Yeah, we don't know the answer to that. There's 2 issues. One is the long-term immunity from the vaccine. How long does it last? So we don't have the answer to that. These trials, there were 3 months, but will go on and we'll get more information. But the second thing is the mutations. So if one of these mutations, like the South African variant, becomes a problem, then there may need to be a booster that contains that's active against that variant too, in addition to the wild type variant. So we don't have the answer to whether you're going to need a booster.
All right. Someone else have a question? Time is now. Ms. Beverly, you should be able to go ahead.
Yes. So is it true that once you have contracted the virus, you develop antibodies?
That is correct. So once you've contracted the virus, well, not everybody develops antibodies. Over 90% of people will have antibodies. And so that does give you immunity. So, you are protected against getting reinfected, but so you can still get reinfected later. It's unlikely that that's going to happen within a 3-month time frame. So as far as the vaccine goes, if you wish to wait, you can wait 3 months to get a vaccine because it's unlikely to get reinfected during that time. But you don't have to wait 3 months. If you're ready to get a vaccine and it's available and you've had COVID less than 3 months, you can get the vaccine then. And remember, the antibody response to the vaccine is better than you get from natural infection.
Okay. One more question. So once we're vaccinated, we have had both doses. How soon after that can you wait to? We have grandchildren that are out of state that we want to visit. How soon should we wait prior to going to visit to see the grandchildren?
Mary, you want to take that one?
Yeah, because I'm a grandma too. Yeah. So there's sort of 2 parts to that question. The first part is, when would you achieve full immunity? And the answer to that is 2 weeks after your second dose of vaccine, you should have full immunity. The other part of the question is it then going to be safe to see grandchildren, to travel, to do all the things that we so want to do. And unfortunately, the answer there is it's still not perfectly safe. It will be safer once you have been vaccinated and have achieved immunity. But until the level of transmission in our community goes down and the level of transmission across the country goes down, there will still be risk involved in doing all those things that we so want to do and long to do.
Okay, thank you.
We'll get there
I have a
because the
question.
vaccine, getting the vaccinated is the next step to get the cases down. So,
Mm.
the hope is that enough people are immune, the cases will drop off, and then, we're almost there. We're just not there yet.
What about the young people in terms of transmission? What's the age? Are we looking at the babies? Are we looking at the elementary school age children? Are they also transmitting?
Yeah, so this can be transmitted at any age. I mean, I think there was some question before about whether children can transmit it. I think that's pretty much been proven that they can. The thing about children is they're not as likely to get as sick, and they're not as likely to get severe disease. And so it's possible they may not be as infectious as long, but they can still be infectious for sure.
Great. All right. Other questions?
I have a question. Somebody mentioned about the antibodies. I'm just looking for clarity. If you think you had COVID back like last year, early on, before the huge outbreak, how long can they determine what test could you take to determine if you still had it?
So you want to find out if you've had COVID back in, let's say, March or April, but you didn't get tested by PCR. Yeah, an antibody test would tell you. That would be evidence. If it's positive, that would be evidence that you've had COVID before. But it doesn't mean that you shouldn't get the vaccine, because that period of time, 6 months, the antibody level drops, and you could still be susceptible to get reinfected. So you could do it as for curiosity, but I wouldn't recommend doing that to decide if you need to get the vaccine.
Thank you.
How reliable is the antibodies vaccine? Test. How reliable is that, the efficacy of that test?
So you mean, I think what the question is the sensitivity, what they call the sensitivity and the specificity. So
yes.
For the sensitivity, what it means is if you've had it, what's the likelihood that it's going to be positive? And then the specificity is if you didn't have the disease, what's the likelihood that it's going to be negative? So I think those numbers, it's like 99%. So it's, right now, COVID is so widespread that it's a pretty good test. We'd be careful if it was testing it on someone who was unlikely to have it. You could have a false positive. That's always possible, but it's a pretty good test.
Good. Anybody else?
I have one other question in regards to COVID. I know that they say that sometimes people have longer term effects after having COVID-19 that may last months, years, or whatever the case may be. Well, we don't know if years or not, but at least months. Is there any correlation between that and being considered that being a pre-existing condition going forward? If they have COVID-19, is COVID-19 considered a pre-existing condition now going forward? If they have, respiratory issues going forward, even after being infected by it?
Oh, I see what you're saying. Yeah. I don't know the answer to that. I know, for some people, people who've had very severe infection with COVID where they had to be in the hospital, they had pneumonia, that can cause what's called ARDS, and that can cause chronic lung problems. But if it's something that was, you were very sick and you had long symptoms, if it doesn't have any, effect on the lung itself, then it's not likely to really cause any long-term, physiological health conditions. Long COVID is not well understood right now. We're still learning about it, but I think that, kind of depends on the severity of illness, I guess.
Right.
That's the best I can say.
Thanks.
Quick question, Dr. Pinsky. Will this vaccination be made mandatory or voluntary, especially when it comes to employers and employees?
Yeah, I can't tell you the answer to that. I mean, right now, the vaccine availability, no one is going to make this mandatory. There's just not enough to do that. But, in the future, when there's a greater supply, for instance, some workplaces, there's precedent for this, in schools, all children are required to get measles vaccinations, for instance. So there could be a time in the future where it may be mandatory, but that's not going to happen for a long time.
Can you speak to the pros and cons of a ventilator if someone has COVID-19?
Yeah, well, that would be, for someone in the hospital who has severe respiratory compromise, where they can't breathe on their own, they would put on what's called mechanical ventilation. There's also other things called non-invasive pressure ventilation, where they can give high oxygen flow through the nose, or they can give inhaled oxygen, or through a face mask. So there's other ways that they can ventilate people without putting them on a ventilator. Ventilator would be kind of like the last resort. It's really pretty much to save someone's life. That would pretty much be the only time that you use it.
Can you talk about
Did we lose her? Hello?
Yes, sorry. I missed that.
I'm sorry, I was muted. Where there's 3 persons in the home that was able to get the vaccine, 1 person that's not able to get the vaccine at the recommendation of their physician. So how do we conduct ourselves in that particular home with that person that's not able to get the vaccine?
So there's 3 people in the home that can get the vaccine, but the other person,
The other person was diagnosed with Guillain-Barré.
Oh, I see. Okay. So, yeah, I mean, I think that you just have to, stick to the same guidelines that you would do before you got vaccine, because we don't know. What we don't know is, how well does it protect against asymptomatic infection? We know it protects you against getting sick. So it is possible that you could pick up the virus, not get symptoms, and then transmit it to someone else who is more susceptible. And so if that person hadn't gotten the vaccine, that person could get sick with it. Now, it should protect you against asymptomatic infection, but we don't know the degree to that. It just hasn't been studied. So, you just have to be safe and resort to your normal mitigation strategies, I guess. That's the best answer I can give.
I just saw something in the chat from Mary that I thought was interesting, and that is the fact that a person that's been vaccinated can still be a carrier. I don't know did I get that right?
Well, and that's to Dr. Pinsky's point, is that was not studied in the clinical trials. So the clinical trials proved that the vaccine was very, very effective at preventing COVID illness, but they didn't study whether or not after being vaccinated, you could still carry the virus and pass it on to others. And so until we know more, that's why even after vaccination, you still have to do all of those common sense things that we've been doing, like wear a mask, watch your distance, wash your hands.
Very cool. Good, good.
And also in the chat, and I want to maybe direct this one to Dr. Pinsky. There was a really great question about why is it that some people in the same house with COVID patients get it and others don't? And does blood type have anything to do with it?
Good question.
Yeah, so a lot of that is unknown. It could be the amount of virus you're exposed to. And it also, has to do with your medical risk factors. We know that people who are older are more susceptible. People with obesity are more susceptible. People with cardiovascular conditions are more susceptible. But a lot of it is just luck. You may be exposed to the virus at the wrong time and the other person isn't.
Well, all right. Anybody else? Just have a few minutes here.
I have a question. Going back to the children. So should we hold off until, I know like you're saying, if it's good for the adult to be vaccinated to be around their grandchildren, but then what kind of risk are we putting the children at if they're not vaccinated yet? And how soon do you think they will start to vaccinate children?
Yeah, so the vaccine is being looked at for people 12 and over right now. So they're studying that. And then, my understanding is if that's approved, then they can also study it down to younger and younger age groups. So it's possible that it may be approved for children as young as 6, later in the year. As far as precautions, then, yeah, so I think the vaccine, is more, it will protect you against getting severe disease. And I think that the idea of wearing masks is also to protect yourself, not just protecting others too.
Yeah, and as Dr. Pinsky said before, the whole idea is as more and more people in our community become vaccinated and develop immunity, then transmission will go down, and that will protect our kids too.
Very good. Any more questions? Like 5 minutes we have left.
I have a question. Thanks to the speakers, I wanted to check the COVID saliva test. And I think U of I is doing this. I work at a college, so I'm a little curious. Are those saliva tests, are they like any other COVID test? It's a point in time, meaning if I get the saliva COVID test this morning and it says I'm negative, theoretically, could I go hang out with my friends and then be positive and think that I'm still negative?
Yeah, so
And if
the
that's
thing
the
with the
case,
PCR
like what's the
test is,
value of doing them? Yeah, go ahead.
yeah, sure. So it's the same as any other PCR test. It's just you can do it in the nose. You can check the saliva. The results are the same. It just tells you if you have active infection on the time that it's been tested. The thing is, though, the incubation period, remember, can be anywhere from 3 days to 14 days. So if you get tested negative and you were exposed yesterday, then you could still turn positive tomorrow. So it's only as good as, the day that you get tested. So that's why, there's been situations where they've had mandatory testing, but there's still been COVID. There's been still some super spreading events. And actually U of I is an example. They did testing for all the students, but they still had a big surge of COVID. And that was because they were doing the test like twice a week. So someone get tested one day and then 2 days later they're positive, but they don't get tested till 2 days after that. So you really, testing doesn't completely eliminate the possibility of transmission in that sense.
Thank you.
Beyond the known soreness, the immediate reaction to the vaccine, any known other side effects that's been documented thus far in reference to taking the vaccine?
No, that's interesting because they, in the 30,000 initial cohort, they had half the group get vaccine and half the group get placebo, and they didn't see anything different for severe adverse reactions. It was just those localized reactions and fevers and chills. Now the vaccine's been given to millions of adults. The one thing that we want to be careful for are those allergies. But even that is very rare. That was been like, 2.5 per million for the Moderna. And I think the Pfizer was a little bit higher. That might have been 5 per million. Don't quote me on that, but those are both very rare. So there hasn't really been any other safety issues to date. Fortunately, we're lucky about that.
So when you speak of allergies, that's any allergies, seasonal allergies, or those?
No, what I mean is a severe allergic reaction. So severe enough where someone would have what's called anaphylaxis. But other less common, less severe allergies can occur. But those aren't severe. So if you have something like that, it's not life threatening, but those are also rare. But if someone has an allergy to the COVID vaccine, then obviously you can't get that vaccine.
Well, this has been great. We're going to wrap it up. I want to thank Dr. Pinsky and Mary Anderson for putting on an extraordinary and informative presentation tonight, answering some hard questions and being clearly prepared with an understanding of this disease and the treatment or the vaccine. And we'll be praying for you all as a community. I'm always very, very appreciative. I thank my own personal physicians either directly, or I should say directly, and sometimes I utilize my chart to appreciate them and to share with them the fact that I do pray for them by name. And I would like to invite the community to add you guys to that list, because it's no small thing to do what you're doing. It's very difficult and challenging thing, not only for our community, but for the world. And the fact that you're on the front line and have a willingness to do this is of great value to us as a community. So we appreciate you, appreciate your time. And hopefully you have a nice cold glass of wine chilled and ready for you when you get off this call. And I want to thank everybody here for attending. Those of you who are guests, appreciate your coming to be a part. We're going to continue with these kinds of forums. This virtual opportunity is providing opportunity for us to speak to people across the country. So we want to thank you. In the morning, 7:30 a.m., as is the norm, Monday through Friday, right here in the same space. You can join me for devotion, 7:30 a.m. Central Time. It's a 30-minute window, and we have a really good, uplifting time of sharing. You are invited to come and invite your friends. All right? Peace and blessings to everybody. Dr. Pinsky, Mary Anderson, again, thank you, and enjoy your evening.
Thank you for inviting us. This was very fun.
Yeah,
Thank
thanks.
you guys.
Good night.
Thank you.
Thank you all. Thank you.
Bye.
Thank you. Bye-bye.
Bye, everybody.
Thank you.
Yes.